Hello everyone, today we'll be looking at an overview of the anatomy and histology of the cervix. It is an important preamble to the screening and management of cancer of the cervix. So as we know, the cervix is an opening to the uterus. It is cylindrical in shape and it is normally 3 to 4 centimeters long and 2.5 to 3.5 in diameter. The external os of the cervix opens into the vagina, and the internal os is the point at which the cervix and the uterus meet above the vagina. So the parts of the cervix are the ectocervix, the endocervix, and the endocervical canal. The ectocervix is exterior to the external os, and you see it when you do a speculum exam. The endocervix is above the external os and it may not easily be seen. And the canal traverses the endocervix, connects the uterine cavity with the vagina, and extends from the internal to the external os. The cervix and the external os vary in size and shape depending on the woman's age, the parity, the pregnancy, and the hormonal status. In nulliparous women, it is small, round pinhole, and in older women that have had children before, it is large and irregularly shaped. So here we have the basics of what we were talking about. This is the fundus, the fallopian tube, the ovary, the body of the uterus, the external os, the internal os, and the endocervical canal in between the external and the internal os, the fornix or the posterior fornix. So here we have the cervix of a nulliparous woman. As you see, it is a pinhole. Yeah, it is a pinhole. And for a multiparous woman, it is more of a gaping slit. So there's an obvious difference between the two. So the cervix is composed of dense fibromuscular connective tissue, and it is covered by two types of epithelium. You have stratified squamous epithelium and you have columnar epithelium. And where the two types of epithelium meet, it is known as the squamo-columnar junction. The stratified squamous epithelium is on the outside of the cervix. It is what you see when you do a speculum. When you put a speculum, what you see that appears pink is a stratified squamous epithelium. In adult women, there are two types. There's the original squamous epithelium, which is formed during embryonic life, and there's metaplastic squamous epithelium, which is formed later in life. Layers of squamous cells on the ectocervix are 15 to 20 centimeters, 15 to 20 cells deep. The basement membrane separates the squamous epithelium from the underlying tissue. So the basal cells mature and divide to form the next layer of cells. From the basal to the top layer, the cells increase in overall size, while the nucleus of the cell decreases. So here you have the basement membrane that separates the squamous epithelium from the rest of the tissue. Then you've got the basal cell layer, the parabasal, and so on. So as you can see, the squamous epithelium, the stratified squamous epithelium, has got various layers of cells. Then the other type of cells that you find on the inside of the cervix now is the columnar epithelium. On the outside, on the ectocervix, you get this stratified epithelium. On the inside, you get the columnar epithelium. This one is a single layer of tau cells with a dark staining nuclei. As you can see, this one is a single layer of cells. So here we've got an illustration of the squamous epithelium on the ectocervix, and you have the columnar epithelium on the inside as you are going into the endocervix. And the squamocolumnar junction is where the two meet, where the columnar epithelium, which is outside here, and where they meet, the squamous epithelium and the columnar epithelium, where they meet is where you form the squamocolumnar junction. So squamous metaplasia refers to change or replacement of one cell type by another. And squamous metaplasia in this particular case is a physiological process that occurs on the cervix. So the columnar cells on the side of the squamocolumnar junction closest to the os are gradually replaced with squamous cells. The process results from exposure of the columnar cells to the acidic environment of the vagina. So once again, you have the squamous cells on the outside and the columnar cells on the inside. Where they meet, you have the squamocolumnar junction. So as a woman proceeds through life, and depending on the estrogenic status of the woman at that time, if she's pregnant, if she's on combined oral contraceptives, or if she's at menarche or at premenopause, there is replacement of these columnar cells, by these squamous cells. So that process whereby these cells replace these cells is known as squamous metaplasia. So we also talked about the squamocolumnar junction. The original squamocolumnar junction is laid down during embryonic life, and it is visible during childhood, before menarche, after puberty, and in the early reproductive years. It is on the outer cervix, away from the os. Now, the area between the original squamocolumnar junction and the new squamocolumnar junction is known as the transformation zone. The transformation zone is covered by metaplastic squamous epithelium. That is squamous epithelium that has replaced the columnar epithelium that existed in that area. So a new squamocolumnar junction is formed where the metaplastic or the growing squamous epithelium meets the columnar epithelium. The transformation zone is the area bounded by the original squamocolumnar junction moving towards the external os after menarche and throughout the reproductive life of a woman. So this illustration shows the cervix of a woman from childhood up to postmenopause. So you have the original squamocolumnar junction here. Remember that the squamocolumnar junction is formed at the point where the columnar epithelium, which is in the endocervix, meets the squamous epithelium, which is on the ectocervix. Where they meet, you have the squamocolumnar junction. So as a woman is going through life, the squamocolumnar junction shifts depending on the estrogenic status of the woman. For example, when she's an adolescent, there is a replacement of this columnar epithelium. It is gradually replaced by the squamous epithelium that is coming from the outside, in a process that we've mentioned to be squamous metaplasia. So what happens is that there is that old squamocolumnar junction that she had when she was born with, and the new squamocolumnar junction that has come about after there has been a replacement of the squamous of the columnar epithelium by the squamous epithelium. So now that area is a transformation zone. So remember that the transformation zone is that area that is formed between the original squamocolumnar junction and the new squamocolumnar junction. That is the transformation zone. That is the place that we look at when we are looking for, when we are screening women for cervical cancer. The place that we are looking at is the transformation zone. So as you can see on this one now, this one is a postmenopausal woman. The squamocolumnar junction, there has been a replacement. There has been a replacement of the columnar epithelium by the squamous epithelium upwards into the endocervix. So you find that the transformation zone has shifted inside compared to this one. The transformation zone is fairly on the outside. You can see it when you put a speculum. But in a woman who's postmenopausal, the transformation zone is inside the endocervix. The significance of this is that when you're going to examine a postmenopausal woman, when you're going to screen her for cervical cancer, you might have challenges visualizing the transformation zone. First of all, her estrogenic status has changed. She's got less estrogen. So she's got atrophy of the vagina, she's got atrophy of the cervix. And also she may have prolapse of the bladder, making it very hard for you to to see the cervix. I would advise that when you're going to screen older women for cervical cancer, you do it in the presence of someone who is senior. So the anatomy of the cervix, like we have seen, is influenced by the estrogenic status of the woman. The location of the squamocolumnar junction changes throughout the woman's life in response to changes in the estrogen levels. So there are increased estrogen levels, for example, at menarche, when she's using oral contraceptives, or when she's pregnant. At this time, the cervix will be swollen and it will be big. There's evasion of the endocervical epithelium out into the ectocervix, and that way it is easier for you to see the squamocolumnar junction. Now, as a woman ages, like we've seen in the diagram, the squamocolumnar junction retreats inwards towards the internal os, making it more difficult to see. So it is important that we understand the anatomy and histology of the cervix as we go and manage patients with the precancerous lesions of the cervix. The squamocolumnar junction is the place where the squamous and the columnar epithelia meet. The transformation zone near the new squamocolumnar junction is the most important area for observation, because this is the area where the abnormal cells of the precursor lesions for cervical cancer are most likely to arise. So that was our presentation on the anatomy and histology of the cervix. Thank you very much for listening, and I hope to see you soon.